Hello everyone, and welcome to this audio podcast. This audio podcast as part of this, as part of this audio podcast, and around a radio edition, in around the radio edition, and this audio podcast will look at CKD science, CKD science through art, and provide an overview in around collaborative works, a sort of a storm robotics collaborative, wherein sort of collaboratively, there was an effort, there have been an effort to highlight different aspects of different aspects around a particular disease, a particular aspect of disease, and in around aspect of disease, and in around in around sort of linking sort of science, aspects of science and healthcare, and sort of unifying sort of different aspects of of um, of art, and sort of providing sort of an evidence base through research and investigation. And so this audio podcast is it will be sort of be a sort of a sort of an overview in around a collaborative works in context of an art book, an art book publication, and it's the first art book it's the first art book sort of publication that's going to be that will be looking to sort of get to be available sort of through through and in and around the sort of public domain, where this works looks to provide opportunities for those who want to be able to sort of document aspects of their healthcare, but also sort of using the art in these book publication, in this particular book publication, and sort of the book publications that sort of are part of this, as part of this as well. The additional book publications, the additional art book publications that come out after this, to basically use the art to sort of help document aspects of healthcare as well. So this provides this audio podcast, as part of this radio edition, will look to provide an overview around CKD science through art, and this will be side A of this particular works. So this book, or this art book sort of publication of works is will look to use use art to raise CKD research through awareness, and it's a storm robotics collaborative aligned with works around the renal patient support group, the RPSG, as one of the main collaborators, really. And basically what the art book is about, is highlighting different aspects of artwork in a book publication, in a sort of book art book sort of overview. And the book is for all allied healthcare professionals, all sort of frontline healthcare professionals, multidisciplinary teams, or MDTs, healthcare service users, healthcare service providers, long-term healthcare disease sufferers, and for those in the public domain. And what is in around what this works is about, or this art book side A is about, is using art linked to important elements of healthcare between healthcare sectors and from a science or scientist perspective, and to raise our understanding of health and disease through our media postings between two international social media platforms for pediatrics and young people and adults suffering with suffering with kidney disease or chronic kidney disease. And in around sort of the mission crux, if you like, the art the art will be in and around the art, using the art through this particular book publication, this art book publication, is to reflect healthcare and to prevent sort of aspects of disparity and also raise equality by linking by linking the art by linking the art, and also where the art allows those who want to document aspects of their healthcare to actually gain a sort of a more sort of a more sort of sort of centric basis in around their healthcare, that also allow opportunities to prompt a sense of a collaborative basis with healthcare professionals as well, so that so that so that aspects of what is documented in the art books can also be used potentially as a way to be documented in patients, in service users who look to have their health aspects of their healthcare as part of their health part of their healthcare in context of their electronic patient records. When, for example, when service users, for example, may want to may go for doctor surgery visits, etc., etc. And so that the art books can be used as a way to document healthcare, and also where service providers can also use the art books to also make notes as well. So a little bit more about this then. So in the contents page, of this is a sort of an author. There's a bit around the author, a bit around the aims and objectives, a bit more around the aims and objectives, and a bit around about what art in around art and doing what words cannot. And then this art book delves into several themes, and those themes are in around theme 1, lab tests and biomarkers. Theme 2 in around biopsy and surgery. Theme 3 is around nutrition. Theme 4 is around renal replacement therapy. Theme 5 is around psychology. Theme 6 is around polypharmacy. Now, theme 7 is around lifestyle. Theme 8 is around primary care. Theme 9 is around wellness and well-being. Theme 10 is around nursing. Theme 11 is around physical activity. Theme 12 is around peer support. Theme 13 is around COVID-19 and infections. And the final theme is around electronic patient records. And I think that's theme 14. And then towards the latter parts of this art book publication, there's an overview in around the RPSG, the Renal Patient Support Group, and the Kidney Disease and Renal Support Group, or KDARS for kids. There's also a basis in around some conclusions, and then some bases in around some acknowledgements and some dedications. And now I'm here. Whilst as part of this radio edition, as part of this radio edition, this audio podcast, a little bit about in around in around the in around the a bit about the introduction. I won't delve into this audio podcast or part of this radio edition. We'll not delve into the whole but sort of art book publication but just provide sort of it will provide just a sort of an overview around this around this audio this CKD science through art sort of book publication. Now, in around the intro, a little bit around the intro. So patients are diagnosed with long-term conditions, or perhaps diagnosed with long-term conditions, are perhaps the most rigorous users of healthcare. A general practice of 10,000 service users or patients will have at least 5 patients with CKD stages 3 through 5, and approximately 15 to 20 of these in CKD stages 4, and around 5 to 10 service users or patients in CKD stage 5. A more elderly or deprived practice population is likely to have higher prevalence, and the all-cause mortality rate in CKD is 30 to 60 times higher than in the general population. And so patients are now being prompted more towards self-care, and this can cause anxiety and stress triggers. And it is important to gain a better insight into the type of stresses experienced by patients in CKD. And there is a push for using sort of technology or tech or aspects of tech to bridge knowledge gaps in healthcare, peer support, and education. But further research still needs to explore guidance in areas of peer support and patient education. And so it is in this context that there is also a requirement to evaluate guidelines for patient and public involvement and sort of focus on where commissioning is wanting. A few focuses could surround e-health and e-learning modules, for example, and where patients and professionals co-produce initiatives. And the UK government had emphasised the importance of tech in improving health outcomes, and providing smarter patient-centric care. Such initiatives would be supplementary to care documents that already exist as part of, for example, again, electronic patient records or EPRs. But of course, any health education provided will also require documenting and transfer of information, connectivity of any future tech, or links between EPRs and knowledge provision would need to be fast, reliable, and general data protection regulation compliant, or GDPR 2018 compliant. There is now more sort of need to improve healthcare integration for people with long-term conditions, and this remains as one of the most important challenges facing the National Health Service, and as a society. And with advances in point of care, improving care for people with LTCs must involve a shift sort of from reactive disease focused, a fragmented model of care towards a proactive, holistic and preventative, wherein people with long-term conditions are encouraged to play a central role and take ownership. Now this sort of art book publication has 14 different themes, and what it is in around this. There's the themes. The themes are a collection or a basis in around an applicability to adults suffering with chronic kidney disease, for example, and also pediatrics and young people that are suffering with chronic kidney disease. And so what happens is that also as part of this, there was a collaborative effort wherein between the RPSG and KDAR's social media platforms, there were several bases around these different themes, and where data and where initial sort of data had been collected around these particular themes, around these particular themes between the two social media platforms. And so the books are sort of contextualized, sort of brief quotations around these different themes. And then the idea is that service users and healthcare professionals who for example want to ensure that patients in alongside different different aspects of healthcare are able to can ensure that there's a basis in around recording aspects of healthcare, and you again use the themes as sort of a basis, and then there's a little bit of sort of educational context that follows as part of the theme as well. So for example, theme one in around lab tests and investigations, there's aspects there's a basis in around lab test investigations applicable to adults suffering with kidney disease, chronic kidney disease, or CKD, and then lab tests and investigations aligned to pediatrics and young people suffering with chronic kidney disease. And then there's the educational context, which sort of brings together brings together the basis in a sort of in an overview way around that theme, on a page that's referred to the ed context, which ed being short for abbreviation for educational context. And then after the educational context against each theme, there's a notes page. And that notes page is a page where healthcare service users and healthcare service providers can document aspects around healthcare against those particular themes. And then that way in aligned to particular for example, where service providers service users and service providers are sort of involved in documenting aspects of healthcare, can again use the notes as points of reminders between different times in between different healthcare sectors as one thing, and also different time points in around aspects of healthcare. Now, as per mentioned, this particular art book, there's the art. So there's the educational, there's the qualitative aspect that has been collected, that has been sort of co-developed between the RPSG team and the KDARS team. And then the art are a mix between media postings that have been posted on between the RPSG and KDARS, RPSG and KDARS social media platforms, but also then where the art, and around the art there is then the qualitative context, which also again sort of helps sort of bring a sense of reminder around that particular theme. So there has been some research out there and literature out there published in sort of published works, where for example where service users and service providers, for example, when service users have appointments, sort of have clinical appointments or medical appointments, for example, they can often unfortunately forget, for example, forget in around different aspects that they may want to highlight in around their appointments, and so the art books are a way of a reminder as well, and so the art books, the art book, or this particular art book, again has 14 different themes around different aspects of healthcare, different aspects of healthcare, and then towards the end of this particular art book, there is then an acknowledgements, a sort of an acknowledgements page. There's a dedications page, and then the back page of this art book, in around CKD through science. There is an abstract which sort of contextualizes basically which contextualizes the sort of generality in around what side A of this art book is about allied to evidence-based through research and investigation. So that is the basis of this art book and this works, and there are three sort of subsequent art books that are linked, are sort of linked with this, and will be available sort of in the public domain in due time. But I thought I'd throw together a sort of an overview, as an overview of this particular works, so that listeners can get an overview about this works through this particular radio edition. So that draws this audio podcast to a close, in around this overview around CKD science through art, and where this audio podcast, and as part of this radio edition, sort of provides an overview around side A of this art book, and so there will be in on social media, there will be some other additional sort of citations where listeners out there may want to can refer to for additional works, or additional sort of perspectives in aligned to works around this. So thank you for tuning in. This has been an audio podcast, sort of providing an overview in around the CKD science through art and evidence-based through research and investigation. This is an audio podcast as part of the radio edition, and also a sort of a research and analysis. Thank you for tuning in.